Hello and welcome to another episode of the Diverse Thinking Different Learning podcast. Thank you so much for joining me today. I am so thrilled about my guest today. She is someone who has actually been on the podcast before when we first launched the podcast, and her work and expertise are incredibly aligned with the heart of the work that we do at Child Nexus. Dr. Vindia Fernandez. Dr. Fernandez is the founder and clinical director of the Center for Pediatric Neuropsychology and also serves as a director of pediatric neuropsychology at the UCLA Cultural Neuropsychology Program. I am thrilled to have her here to discuss assessing learning differences in bilingual children and children enrolled in dual language programs, a topic of growing importance as our communities become increasingly diverse. Please join me in welcoming Dr. Fernandez to the podcast.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Dr. Fernandez, welcome back to the Diverse Thinking, Different Learning podcast.
Thank you, Karen. Thank you so much for inviting me back again.
It's great to have you here. I look back, and like I was saying to you before we hit record, is I saw that you were here on episode 3. Now we're now in the 200s.
I can't believe it. I'm so just thrilled for you at how successful this podcast has been.
Thank you so much. And again, you were on episode 3. You were one of the first people I wanted to have on the podcast. And you spoke about neuropsychological evaluations through a cultural lens. And it's been 4 years since that recording. And it's just amazing to think that it's been that long.
I know. We were overdue.
Yes, definitely overdue. And it hasn't been 4 years since we've seen each other. Obviously, we just both presented at the Help Group Summit.
That's right.
You presented on a topic related to kind of what we're going to be discussing today. And I'm so glad to have you here again to talk about this topic.
Thank you. I mean, as you know, this is a topic that's near and dear to my heart. When I started my private practice, I really started it to expand high quality services for diverse learners. So, this is exactly why the kind of thing I want to be discussing and just helping other folks to increase their knowledge base about what these types of evaluations look like.
Absolutely. Absolutely. And, in our practice, we often refer to you when there is, a child who's bilingual, because it really is a very specific type of evaluation that needs to be done when kids speak 2 languages. But I'd like to start by talking about bilingualism in general, and then we'll jump into the assessment piece, because bilingualism is often seen as both an asset and a challenge. And I'd love for you to talk about kind of in general, how bilingualism impacts, cognitive, linguistic development in children. And then we can kind of jump into the assessment process.
Yeah, for sure. Bilingualism is one of these topics that I feel is often misunderstood among folks. You hear that talking 2 languages often causes speech delays in children, which isn't always true. As a matter of fact, that's probably the exception, not the rule. And certainly we know that there are certain vulnerable children who are already vulnerable to language differences who may struggle to learn 2 languages. But in general, being bilingual actually affords children some real cognitive benefits, including boosts in executive functioning. If you can imagine having to switch between 2 languages all day, really does a lot for your flexibility and your switching abilities. And so many bilingual children test as having advanced executive functioning. So we do know it's good for children. Of course, when children enter the school system and are maybe more dominant in a second language other than English, they do sometimes have some challenges in adapting and learning because, of course, they may not understand everything that's being said in the classroom. And so that can present with some challenges, especially during those early stages of introduction to the school system. So kindergarten, preschool, kindergarten, first grade, those are kind of the critical years for adapting to an English language curriculum. And so when I get a kiddo referred to me that has some challenges in the classroom, whatever they may be, one of my primary goals is to try to identify where they are in their language learning process because it's a dynamic process and it's different for every child. You asked me to talk a little bit about bilingualism in general, and I think I'd be remiss if I didn't mention that there are different types of bilingual children. There are some children who learn both languages, English and Spanish, or another language, from the very start. Right? You have parents that maybe are English speakers, but you've got grandma doing the majority of caregiving and she may speak the other language. And so there are some kids who we consider simultaneous bilinguals, where they learn both languages from the start. And then there are kids who we consider sequential learners. These are kids who maybe only speak one language at home, but are introduced to that second language primarily through the educational environment. And so they're going to have totally different trajectories.
Right. And I'm really glad that you brought that up because that comes up a lot, and especially in the Los Angeles area. And it's probably true for other areas of North America as well, where English speakers, and I guess that would be the sequential bilingual learners, go to an immersion school, right? It's not the language that's spoken at home, but parents want their children to have that bilingual experience. And so they enroll them in a bilingual preschool, bilingual elementary school. And so all throughout the day and all of their educational instruction, for the most part, or at least usually it's 90% of their instruction initially, is in their non-dominant language for them.
Absolutely. I'm so glad you brought that up because in the last 5 years, I've seen an uptick in the types of referrals that I'm getting in my private practice, and even at UCLA, where I also work part-time in the cultural neuropsychology program. We've been getting more and more kids come through who are bilingual learners because of their enrollment in dual language immersion programs. And this is a big change over like the last 10 years, maybe 15 years. I'm probably going to forget the exact date, but there was a recent law that was enacted allowing dual language programs to be proliferated throughout California because prior to that, we really didn't have anything like it. So this is really uncharted territory. And a lot of folks don't know what to do with bilingual learners and dual language immersion programs, but that's why I'm here, right? So we can talk a little bit about what that looks like.
Absolutely. And I'm really glad you brought up that initial point about the fact that bilingualism can enhance cognitive functions, especially when you think about executive functioning, which we've talked a great deal on this podcast. And a lot of that probably has to do with having to shift back and forth between two language systems in your brain on a regular basis.
Yeah, exactly. And so I find that more and more, monolingual English speaking families are making that choice for their students, for their kids, and enrolling them in these programs. And, just as an aside, I find it so fascinating and it's so adorable to seeing children just picking up their second language so quickly. And it's just baffling how absorbent children's minds are and how quickly they can pick it up.
It really is. I mean, both of my kids went through dual language preschool and early elementary school programs. My daughter was in Mandarin and Spanish immersion, and my son was in Spanish immersion up until second grade for him and third grade from fourth grade for my daughter. And it's incredible to see how quickly they can grasp a second language and communicate effectively with educators and other students in the classroom. So it's amazing to see. And I'm wondering, for those students who are in that environment or might be, who might have been exposed to two languages initially, are there red flags when we think about learning differences? Because oftentimes it might be harder in those environments to determine, is this a real learning difference like dyslexia or a language-based learning disorder like a language disorder? What are some red flags that might differ from those in monolingual children?
Okay, so I'm so glad you brought up dyslexia because that is exactly the disorder that I worry about the most with bilingual learners. I'm going to focus a little bit on Spanish for a sec because it is the most common type of dual language immersion program, obviously with Mandarin and French being other common programs, but I'm most familiar with Spanish. Um, Spanish is an orthographically transparent language, which means vowels always sound the same, which makes it super easy to learn how to read in Spanish. So what I've found is that teachers often don't spend a ton of time teaching phonics in Spanish language classrooms, which means that for kids who are already vulnerable toward developing language-based learning disabilities, this could be a problem. And so that lack of explicit instruction could, create problems learning English language literacy skills down the line. Because if you think about it, English literacy skills are much more complex because vowel teams are varied and they can, you can have 5 different ways to make the aw sound. So you could have the letter O, the letter AU, the OUGH, and, there are different ways to make a similar sound. And so English is much more complex in that way. And so if you're not getting that explicit instruction, you're much more vulnerable to developing something like dyslexia. So if you're seeing that your, you know, child isn't able to transfer some of the skills that they've been learning in Spanish to their English literacy skills, and their English literacy skills are falling behind, those are certainly red flags. If the child is much more frustrated at being in a Spanish classroom than other children in that same classroom, that could be a red flag. I do frequently see some children that struggle to learn the Spanish and maybe don't have the same vocabulary development that other children do, really struggle with just understanding the teacher's instructions and understanding what to do on worksheets. And that does often create some frustration and anxiety in the classroom that for me is also a red flag. Maybe not for a learning disability per se, but for just struggling academically more generally.
And that is so important. I mean, so many great points that you brought up because the red flags might look different depending on the early exposure to language and then the instruction in the classroom. And so when teachers or parents see some of these struggles that you've mentioned, when they think about doing an assessment, this is where it becomes more complex because you want to have all the time a culturally sensitive assessment process. But how does that look different for bilingual children? Because I think one of the questions comes up is, do I assess the children in Spanish in the example that we're using, or English, or French and English? And how do you make that decision and where do you start?
So, great question. I will tell you that my procedures are different for assessing bilingual children who are in an English-only classroom versus bilingual or monolingual English-speaking children who are in a dual language immersion program.
Mm-hmm.
And I'll tell you why. When you're assessing a bilingual child, again, you don't know where they are in their language learning trajectory. So you have to do some language proficiency testing in both English and Spanish to determine what their dominant language truly is. Because anytime we do assessment, we're always assuming we're getting the best possible data for that child so that we have a reflection of their true abilities. So you want to test in their dominant language, even if English is sort of good enough, right? Because you don't want good enough scores. You want their true abilities reflected. And so for a bilingual child in an English-speaking classroom who is now English dominant, which is what I see most of the time, we can go ahead and test in English, and it's not really much of a problem. However, switching gears a little bit to those kids in dual language immersion classrooms, it almost doesn't really matter where they are. I mean, we also test for language proficiency because I think it's so important to characterize their language development in each language. But when it comes to academics, guess what? We have to test in English and in Spanish in order to determine whether or not there is a learning disability. And I can kind of break it down because I think this is really, really critical for providers and for parents to be aware of. Because like I said, it's pretty uncharted territory. But let's say that you have a child that's from a monolingual English speaking household, right? Both parents speak English most of the time. They speak English to their brothers and sisters and their friends in English most of the time. Um, if this child were only to be tested in English, you would potentially be putting them at a disadvantage when you're testing their academics. Because guess what? Their language of instruction is Spanish or another language. They've never had academic instruction in English. So it's really not a fair assessment of their abilities in English. Okay. And so you need to test those kids in Spanish to see what they've actually picked up from their educational program. Okay. But because this is their second language, again, they're not going to have the same strengths in Spanish or in the other second language, right? So this is also sort of not a fair assessment of their abilities. It's only by comparing and contrasting and looking at their strengths and their needs in each language that you can start to see a pattern that may or may not reflect a learning disability. But really, unless you assess in both languages, you're not doing these children, you're doing them a disservice if you're not testing in both languages.
And I think that's such an important piece and such an important thing for educators to be thinking of when they're making those referrals, for parents to be thinking of when they have, kids who are bilingual or who are in dual language programs, because that's such an important piece in understanding whether or not there is a learning difference and what type of learning difference that is, because then that will also inform the type of intervention and support that child needs.
Absolutely. And can I add one more detail about this? And again, like I said, it's sort of uncharted territory. So it's important for folks to be aware that in Spanish, you actually don't see the same type of phonological dyslexia that you do in other languages. Again, because it's so transparent, right? So what you normally see with dyslexic learners is an issue with reading fluency. And you start to see a few other things, like maybe they're not really placing the right emphasis on the word, when there's an accent over a certain letter. And there are other things that you can look at for that context that you need, but you don't normally see the same phonological issues that you do in English. So I'm actually looking for different patterns in English and in Spanish. Yeah.
Right. And that's really helpful when we're thinking about learning difference like dyslexia or learning disorder like dyslexia. What about language disorders? So it's a whole other kind of falls under the same umbrella of learning differences. But when, their phonological processing is fine, but maybe their ability to understand language and to express language is delayed relative to their peers. How do you assess for that? And again, I think we're going to talk about this later, but I think there's a lot of under referrals for this issue in bilingual students because they attribute some of the language difficulties to the fact that they're bilingual.
I see this all the time, especially with younger learners. And we, to be fair, we don't want to over pathologize bilingual children as they're entering the school system, and they do need some time to adapt to the language of instruction. And usually, we actually know this from research, that it takes anywhere, between 3 to 5 years of, constant high quality exposure to actually reach the same level in English proficiency as monolingual English peers. But that process should end for most kids by about 4th or 5th grade. So if you're seeing a child persist with language difficulties beyond about 4th grade, and I personally would argue that we need to flag these children way before they start failing and showing severe deficits, then that's a red flag. That's a big red flag. What I often see, and I think this is important for children who maybe, had a speech delay or, are on the autism spectrum, who are more prone to having language differences. If you see that the child is not picking up either the English or the Spanish, that's a huge red flag. And again, this is something you can only determine if you test in both English and in Spanish. You can only figure that out if you test in both languages.
Yes. And I think there probably are not enough clinicians who have the skills to be able to do that. And then I also think to some degree, there's been this overcorrection from Brown versus the Board of Education that has led to kind of an under-identification of language disorders, learning differences in children of color and bilingual children. And I think there's now more of a systemic change moving in the right direction, but there's still an underdiagnosis of learning differences in many communities.
I absolutely agree with you, Karen. I feel like that was one of my biggest motivating factors in starting my private practice, as I was noticing the pendulum just had swung the other way completely. I think people are terrified of over pathologizing children. And I think it's a sign that people were listening. Back when, we were trying to move children away from, special day classes and classes that were over pathologizing children who maybe were just learning the language. But it did sort of swing the other way. And so I think in order to correct course again, we do need to develop evidence-based strategies for determining language and language-based learning disabilities.
Absolutely. It's so important. And again, our whole goal as clinicians who work in this space is to make sure that if children are struggling, regardless of their background, that they are adequately assessed and difficulties are identified so that they can get the support that they need in order to thrive at home, at school, and, in their interactions with their peers and family members.
That's the bottom line. We want these children to be able to feel successful, to be confident, to be able to communicate effectively with others, to be able to access the curriculum. And if we're not adequately assessing their strengths and needs, then we're not really giving them a fair chance to meet those milestones.
Right. And once a learning difference is identified, so someone gets their child in, they see you, you're identifying, you're testing them in two languages because that's that's what their background calls for. Once a learning difference is identified, what intervention strategies have you found to be effective for bilingual children? And then the second part of that question, and is actually embedded in that question, is with the intervention, for example, for dyslexia, the instruction and the support often is educational therapy or an evidence-based program that focuses on phonological processing. Is that instruction, that educational therapy in Spanish or English?
Great question. This is something tricky. I'll tell you what, I think thinking about educational law is inevitable when we have this conversation because there is no current legal mandate to provide special education services in the language of instruction when kids are in a dual language immersion program, which to me is insane. It doesn't compute. So if a child is struggling to learn, the academic skills in Spanish, let's say, they are only entitled to receive tutoring in English. It doesn't make any sense. Hopefully that will change. But to your original question about providing intervention services, because many parents do end up providing tutoring for their children outside of school with board certified educational therapists or other highly skilled tutors, which is the gold standard treatment for things like dyslexia. I do recommend that they teach in the language of instruction. So you need to be able to tutor children in the skill that you want to see improve, in the language of the skill that you want to see improve. So if you want, let's say a child actually has pretty adequate literacy skills in English, because that's their native language and that's what they're most comfortable with. But they're really struggling with some of the Spanish because they're unfamiliar with the vocabulary and whatnot. They really need to be tutored in Spanish. Okay. But if the kids are, learning Spanish phonetics, because again, they're orthographically transparent, not too difficult, but they're really struggling to pick up the reading in English, then they need to be tutored in English. You teach to the skill that you want to see improvement in, and that's the bottom line. So it is sort of a bone that I have to pick with the educational, community, not the educational community per se, but educational law.
Is it the same true for language therapy for those kiddos who have, a language disorder, who have trouble, again, what I was saying before, with expressive receptive language, maybe where the primary language spoken at home is Spanish or English, and at school they're conversing in another language, but there is a language delay in general. What do you recommend there?
This is probably a little tougher because these are children who very often, like you said, are speaking, their primary language at home and are probably in some transition, and experiencing some sort of transition to becoming English dominant. I know that the current, the status quo is to do speech therapy in one language, and usually it's in the target language for school. So usually speech and language pathologists elect, along with the parents, permission to do only English. And that seems to work okay, I think, for a lot of students once they get into school. But as somebody who really appreciates heritage languages and, really values it, and my daughter, is learning Spanish, and I think it's so important for children to hold on to their heritage languages. It sort of makes me sad to know that this is kind of what we do sometimes when really we do have the option of providing therapy in both. And perhaps that means providing more intensive services so that both languages are served. You have no idea how many kids I assess, often on the autism spectrum, who actually have mastered English but have no way of communicating with their own parents. Maybe they understand a little bit of what the parents are saying, but they can't respond in Spanish, so they will respond in English. And then the parents may not understand what the child is saying. It's a sad state of affairs. And it happens with all types of children, not just autistic children. But I do think that more could be done to preserve heritage languages as one of the basic functions of the child's, everyday needs.
Right, absolutely. And that makes me think about, the importance of connection and how that impacts mental health, and being able to communicate in that heritage language with parents, with grandparents, is so important for the overall well-being of an individual.
Absolutely. And think for a second about, kids we refer out for behavioral therapy. How important is it for the parents to get that treatment themselves, right? I would say at least, 50 to 75% of therapy for behaviors is actually done with the parents. And if the parents can't provide the strategies to their child in the home in a language that the child can access, what's that going to do for their treatment plan? It's tough. It's really tough.
I mean, the situation is so complex and there are so many things to consider. I'm thinking of parents who have a kiddo who is bilingual or in a dual language program. Are there things that you've seen that have been effective when the parents are collaborating with professionals and with schools to identify and address learning differences?
Well, as you know, Karen, there are certain things that need to be done with all children that are struggling. And one of the primary things we can do is provide early intervention services before the problem becomes severe. So, if you are seeing a child in early first grade, mid first grade who's struggling with learning literacy skills, no matter what their home language is, you have to provide intervention to bring them up to speed and catch them up before it becomes a problem. And that's no different in English or in Spanish. And so we want to make sure that kids are being adequately flagged, that they're being identified for small reading groups. The public schools actually do have language proficiency testing that they do for kids that come from homes where a language is spoken other than English. And so they are actually monitoring these kids' language proficiency and sort of adapting, special education services accordingly to some degree, which I think is good. But I don't know of any Spanish language reading tests and standardized tests that are being used to actually flag children for learning disabilities right now. And that's a problem. And it's something we need to address as a community as a whole.
Right. It just seems that there are so many, we've made a lot of strides, and it's good to see advancements in research and practice, but there needs to be more integration and understanding in school systems and education systems to, again, make sure that we're identifying kids as early as possible when they're in need of support so that they can get the intervention that they need, because we know the outcomes are so much better when we can get them in there and intervene early.
Absolutely.
So I'm thinking about parents who might be listening and who want to learn more. We've had like a 30-minute conversation, and there's so much more to know. And they may have kiddos who are in dual language programs or who are bilingual, and they're seeing some of the red flags that you discussed. And we know that oftentimes there's this delay in getting kids services because, he'll grow out of it. He's just a boy. Oh, all kids with dual languages have learned to read later or develop language later. There's all of these rationalizations for why kids might be struggling. And I'm hoping that after hearing this conversation that people will kind of ask more questions, will insist on an evaluation, will insist that the school take a second look, because you've probably seen this as well, that parents can get to us really late when a lot of these issues were evident in kindergarten, in first grade, and then you don't see them till fourth and fifth grade.
Yep. So what I would tell parents is that they should try to advocate for their children as early as possible. I would say by mid-first grade at the absolute latest. And one of the things that parents should be advocating for is if their child is in a dual language immersion program, that the child needs to be assessed with formal, standardized measures in Spanish to understand where their child really is falling. Understanding, of course, that, vocabulary development is going to impact, their scores, but we should start to develop some standardization for where children should be in a dual language immersion program. There have to be some normative standards so that we know when a child isn't doing well. So I would be asking for the child to be tested in the language of instruction and also in their native language, and making sure that that's part of any school-based assessment. But if they are interested in getting a child privately assessed, absolutely reach out to folks like myself. There are other allies in the community that do Spanish language testing as well. My private practice, this is one of the things that I specialize in, so you're always welcome to reach out to me. The website is www.pediatricneuropsych.com, and you can always email me and my assistant Lupe at center@pediatricneuropsych.com, and we're happy to talk with you, help you troubleshoot, figure out if a neuropsych assessment is the best next step. I also obviously have connections to the cultural neuropsychology program at UCLA, which offers assessments and takes insurance for folks that aren't able to, pay for an evaluation out of pocket in the community.
Wonderful. I'm so glad you shared your information, because you're such a valuable resource to the community, and you're such an expert in this topic. And I think that you provide such valuable support, understanding, and assessments for families. So thank you so much for sharing that information. I'm going to put a link to your website in the show notes. So if people are listening and driving, you can kind of click on that link when you get home, because again, Dr. Fernandez is a wonderful, wonderful resource. I cannot thank you enough for being here and for having this conversation. Again, I'm a big fan and supporter of the work that you do, because it's incredible work, and you provide so much support for so many families. And you really highlight the importance of culturally and linguistically appropriate evaluations that, again, remind us of the significance of a good evaluation when we want to better understand why kids are struggling and can support them in an effective way. So thank you so much for being here again.
Thank you, Karen. I'm always happy to be here. Have me back again. I love talking with you and, sharing some of, what I've learned over the years with folks. And, hopefully we can move towards really improving the situation for bilingual learners.
That is my hope as well. Thank you again for being here.
Thank you so much, Karen.
Thank you so much for joining us today. Again, if you would like to connect with Dr. Fernandez, be sure to reach out to her. Her information can be found in the show notes. If you enjoyed today's episode, don't forget to subscribe to our email list at childnexus.com to stay updated on our latest resources and podcast episodes. Also, check out our Child Nexus shorts on YouTube for quick, informative videos that you can share with family and friends. Just visit Child Nexus on YouTube. Thank you so much for joining us. See you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.